A survey by the Ontario Medical Association is raising concerns about a shortage of anesthesiologists in the province, which is compounding an existing problem with surgical backlogs. Dr. Rohit Kumar is the chair of Ontario's anesthesiologists, and he joins us live with more on this. So thank you so much for joining us, Doctor. This is obviously deeply concerning when it talk about the surgical backlogs, but you know, when we look at how important the role of an anesthesiologist is in that room, let's talk about how bad this problem is and what are your direct concerns right now?
Sure. Obviously, you know, before the pandemic, we had long wait times and surgical backlogs were an issue. During the pandemic, this was exacerbated, and now post-pandemic, we have a large backlog that's present that we have to deal with. And during the post-pandemic period, we've also noticed that there is becoming a shortage of anesthesiologists within the province, not only within the province, but over the entire country. And this is concerning to us, and we're getting feedback from not only rural and remote areas, but more urban centers like the GTA, Ottawa, Windsor, Kingston, and other areas. So it's really concerning for us.
Yeah, obviously, deeply concerning. We've been talking about a shortage of nurses in the province, which has really been a big talk when it comes to the healthcare system. But this is the first time we're really talking about a shortage of anesthesiologists, which is a crucial component to any major surgery for anyone who's gone through that. And just interesting to note that, you know, I happen to know an anesthesiologist who left his position of a chief of anesthesiology at a hospital to pursue other opportunities. And he talked to me about how dire the situation is in Ontario hospitals. And I was wondering if you can kind of elaborate what happens if we don't find, you know, a lot of these anesthesiologists. What's going to happen to the surgical backlogs, and what's going to happen to the system moving forward?
Absolutely. As you correctly mentioned, anesthesiologists are key players in the surgical system. You can imagine for every surgery that takes place in a hospital, you have an anesthesiologist in that room. So we have 1,500 anesthesiologists across the province. And if we don't have enough anesthesiologists to cover all the surgeries, that means OR closures or surgical delays, which will only further lengthen the wait times that patients are currently experiencing.
What's being done about this? What kind of you know, conversations are being had with, whether it's the provincial government, the Minister of Health? Is there any movement to deal with this, not only the backlog, but with this shortage of doctors?
Yeah, so we're definitely trying to raise awareness in this issue because we need multiple areas of the system, multiple stakeholders to come together to solve this this problem. No one stakeholder can do it alone. The government is receptive to hearing what we have to say, but we really need to move to action. It takes 9 years to produce an anesthesiologist, to fully train an anesthesiologist to provide surgical care. For that reason, we need to act now. In the interim, we do have some short-term solutions that we can implement. And one of those is the expansion of a well-established anesthesia care team model, which was implemented in response to the shortage that we had back in the early 2000s. And what this model involves is training anesthesia assistants to help anesthesiologists extend and leverage the care that we provide to patients to make sure that we have adequate coverage.
Doctor, we have to wrap this up. We only got about 25 seconds left, but I'm just curious, why is it difficult to attract new anesthesiologists here in Ontario? What's been the challenge?
Yeah, so actually it's not difficult to attract people to do anesthesia. The fact is that the demand is so great for our services that we haven't kept up with training the number of anesthesiologists that are required. And every province across the country is facing similar issues. So the demand for our services is so great that we need to find new and innovative solutions to make sure that we can continue to provide the care to patients in Ontario that they need.
Dr. Rohit Kumar, Chair of Ontario's anesthesiologists, we appreciate your time. Thanks for joining us.